Hello, it is National Overdose Awareness Day, and we are delving into the numbers and also personal stories of recovery. Last year, more than 107,000 Americans died from a drug overdose. More than 2/3 of those deaths were tied to synthetic opioids like fentanyl. So here in the Bay Area, San Francisco saw 640 overdose deaths in 2021, more than triple the deaths in Alameda County. Next is Contra Costa with 183 and Santa Clara with 154. And here is a look at the other counties in the Bay Area. Sonoma, the next highest on the list, followed by San Mateo, Solano, Marin, and also Napa. So there have been several approaches to try and curb those numbers, from stricter enforcement to increasing the availability of anti-overdose drugs like Narcan and even safe consumption sites, like San Francisco's Tenderloin Center, which, according to a new study in the International Journal of Drug Policy, successfully reversed 100% of the 333 overdoses that took place there until it closed last December. But that's not the only approach communities are trying to take and battle the issue. And Makovec joining me now in the studio with the newest approach that just got approval. And
yeah, and there are several. I mean, you know, it's like throwing spaghetti at the wall and trying to figure out what might be able to solve this problem. The feds now sending millions of dollars to 3 Bay Area counties to try to fight overdose deaths. Alameda, San Francisco, and Santa Clara all getting more than $2 million each. That funding is part of the CDC's Overdose Data to Action initiative. It aims to make the latest numbers and information available so that the Bay Area can get ahead of what is a constantly evolving crisis. The money is going to go toward emergency tools like Narcan and preventative tools like fentanyl test strips. In Santa Clara County today, we heard from a mother turned advocate.
It took the death of my son to realize there was poison on these streets. And he was poisoned by one pill. He had enough poison in that pill to kill several people.
Santa Clara County just received a separate $11 million grant. They're going to use that money to collect overdose data to try to better pinpoint solutions. There have been 99 fentanyl-related deaths in the county so far this year. Another tool in this crisis, financial incentives. California is launching pilot programs in 24 counties, including San Francisco and Alameda, to basically pay people to stay clean. At SF General, clinicians are testing people for stimulants once or twice a week, and each time they test negative, they get a $10 gift card. The amount of the gift card gradually increases for a maximum of $26.50 per test, and if they test positive, of course, they get nothing. This is all being paid for by CalAIM. That's the state's expansion of Medi-Cal services. And then there's the strategy of laying down the law. The state and federal government has called in the cavalry to San Francisco's Tenderloin, sending in the CHP and federal officers to work with the police and the sheriff's office. This has been going on since late May, and they've been cracking down on drug sales, but also drug use. And that one is getting mixed reviews, as a lot of people end up sobering up in jail, and then they lose their tolerance a bit. They get back out on the street, and they could end up with a dose that's then even more dangerous, having had a break.
yeah, that's true. Bottom line, though, they're trying any solution they can. If there's a number of them and they can see which works the best, then have at it.
Yeah, and that's why data is a big part going forward, trying to figure out what works, best practices, and let's get it moving.
Yeah, all right, Ann, thank you. There's some other programs to talk about. Meanwhile, a San Jose drug treatment program already getting a $6.5 million boost from the state. It will allow them to get 30 additional beds next year. Len Ramirez introduces us to someone who went into the program as an addict and is now helping others get clean.
I'm Shelley Lucero. I'm a mom. I'm a recovering addict.
Shelley Lucero once walked into a recovery house like this as a substance abuser, desperate to change her life.
There's 6 people to a house. We have 15 houses.
She did, and now she's helping others make that change too.
Female walking. Just coming in to check to see how everything's going.
Although Shelley calls her own recovery a work in progress, she's risen to become a manager for Pathway Society, the same San Jose nonprofit that helped her get clean.
Hi.
And today she's checking up on a recovery house for men near the downtown. Her lived experience gives her understanding and empathy for other recovering addicts, but she can also be tough when she has to.
They are allowed to keep things like allergy medication. We just make sure that there's not any weapons.
Shelley says she was abandoned by her young teen mother, was raised by relatives, spent time in juvenile hall, and became an addict by 17.
I was very shy and I was very afraid my whole life. No one ever kept me safe. And so when I used, I felt empowered by that drug or the alcohol.
She quit the drugs and relapsed over and over more than a dozen times. Then she finally agreed to go to recovery just to get out of jail, and it changed her life.
People didn't give up on me. People encouraged me. You know, they loved on me when I couldn't love on myself.
Over the course of her own recovery, Shelley found that she could help herself by helping others, and she discovered her own leadership skills.
I've helped people get their kids back, you know, telling them and showing them that it's possible, and if I can't do it, to lead them to somebody who can. Okay.
Shelley is now poised to help lead Pathway into the future. The agency just announced a $6.5 million grant from the state to build a modern new recovery home with space for 30 additional beds. Shelley's boss says the needs are now greater than ever, in part because of the fentanyl crisis.
In the nick of time, because people need access and a safe place to be. So from that standpoint, it's critical.
But the big moves have affected Shelley in a way no one could have predicted. The new building will replace this small recovery house where Shelley lives as an on-site manager, and it's where she made her first recovery 17 years ago. It's really the only stable home she's ever had.
The little girl in me that, you know, that grew up when she got clean, this is where I felt safe for the first time in my entire life. And so, you know, that's the bittersweet part of it, you know, is that it won't be here anymore, you know. So I'm very grateful. I'm very grateful that, you know, it afforded me, you know, the opportunity to kind of fix that broken little girl that was on the inside, you know. And I'm going to miss it. But I welcome, you know, what's coming for Pathways. I have so much gratitude for this program. So,
but the move can also be seen as another big step in her recovery, and Shelley says she's ready.
Great story. Pathway Society says it will help Shelley with a new place to live. The agency plans to open the new residential facility in June of 2024.